From WRAL News and the Capital Broadcasting Podcast Network, this is your coronavirus news brief for Monday, January 25th. I'm David Crabtree. Before we get into the latest stories, we want to ask a favor. We're trying to get a better understanding of what you, our listeners, want to hear in this podcast. We have a survey that takes about 5 minutes to complete, and we would really appreciate it if you would fill that out. You can find it at wral.com/coronapod. Again, that's wral.com/coronapod. Thanks so much. And now for the latest coronavirus headlines. On his first full day in office, President Joe Biden unveiled his administration's plans for tackling the pandemic. This included a briefing with Dr. Anthony Fauci. I spoke with former FDA Commissioner and Duke Professor Dr. Mark McClellan about the change in approach. Dr. McClellan, good to have you with us again.
David, good to be with you.
Let's start with Dr. Fauci. Again, good to see him and a definite change in tone and approach.
Yeah, I think, David, you should get used to it. These kinds of regular briefings from the scientists with the facts are going to become a routine part of this administration's response. And people have a lot of questions. There is so much going on now with more vaccines becoming available, questions about how to get it, how can we go faster, and everything else too. You know, we've still got very high levels of cases, a need for paying attention to masks, a need for more access to testing, to help schools and other businesses reopen. So there's so much going on now. It's nice to see this higher level of transparency.
Yeah, and Dr. McClellan, is there a way that we can actually live into the science and stay away from the politics? And what I mean by that, we talk here in our business about how important our words matter. And overnight and today, we were hearing there was no plan left for the new administration by the Trump administration. The president alluding to that before he was inaugurated. And today, Dr. Fauci said, hold on, that's not true. There was a plan. We want to take the good from that plan and make it even better. Can we move to where science drives this?
I think we're on the way to doing that. You know, there always is going to be politics involved. We've got political divisions. These are very important issues to all of the American public. But I agree with Dr. Fauci. If you look at where we are the last couple of days, we've had close to 1 million people on average vaccinated, in fact, over the past week. So those numbers for vaccinations are already getting up there, over 18 million Americans. Can we do better? Can we do more? Absolutely. But there is a foundation to build on here, and I think we can work together to get those vaccination numbers up and bring the scientists in even more to help let people know where we are and what they can do to stay as healthy as possible.
Anything surprise you in the president's plan today?
Well, there's a lot there. So a lot of things that the new administration wants to do to build on and make for a much stronger national response. There's going to be a bigger role for the federal government as they envision it. But David, much of this work is going to take a bit of time to implement. So people aren't going to see big changes overnight. And what's going to be very important is, can the new administration take some quick steps fast? The president has aimed for 1 million vaccinations per day. We're at that number now. Can we go much faster than that? Over the next 3 months, we should have enough vaccine available for at least 150, maybe more, 150 million or more Americans. Can we get to those bigger numbers? So those are the things to watch.
Will we see other vaccines on the market soon, in particular Johnson & Johnson?
Well, we'll know soon about Johnson & Johnson. As you know, I'm on the board for J&J. I don't have any inside information, but I do know that that big clinical trial, which is being run across the U.S. and in other parts of the world, is getting very close to the point where the scientists, the independent scientists involved, are going to take a very close look at the data and see if they can proceed to bringing that vaccine to market. That could happen over the next few weeks, and that could be another David, enough vaccine for another 100 million Americans by spring.
Well, the hunger is there. Dr. Mark McClellan, former FDA Commissioner, Director of the Duke Center for Health Policy. As always, we appreciate your time.
Good to be with you.
For the North Carolina Coronavirus Podcast News Brief, I'm David Crabtree.